All right. So, Carrie, thank you for joining. And I'm excited. I am thrilled. I am honored, honestly. All of the above, all of the above. Yeah. So let's just jump right into it. I mean, I think the reason that we wanted to chat and bring you on as our first guest was because ultimately you are a mover and shaker in this space. And you bring this beautiful combination of the science and the research and being a doctor and having had patients for 12 years, or I don't even know how many years now, uh,
15.
15 years
Yeah.
exactly, and running clinics. So it seems like you've seen many elements of this ecosystem. So just to get things started, I think the first question is, what have you seen that's actually changed in the past decade with respect to women's health?
Oh man, that's such a great question. I think the biggest change I've seen is the empowerment that women have had when it comes to their health with social media and with so many platforms now around education, so many amazing books that have come out. I really feel like women now don't just accept, well, I was told I was normal, so I must be normal. And then they just hard stop. They're like, all right, well, I guess I just suffer. Now women are getting told, well, I don't know what to do, or your test result's normal, or you're just tired for whatever reason. Now women are like, nope, that's not acceptable. There has to be something else. And they're asking questions. They're asking hard questions. They're pushing, they're requesting testing. They're using the online sphere to get to order testing, to research themselves. I have great people who are like, learning PubMed to look up research articles. And I just love it because that wasn't happening 10 years ago. And there's a lot more to go. Don't get me wrong. But when I read the comments, when I read the DMs, when I talk to people, other, women are just like, apparently I'm my own biggest advocate. So I am working hard to advocate for myself. I'm like, apparently you are. I am so proud. So that's what I'm seeing.
Yeah, and I think I like that. There is an element of the patient is a new doctor,
Hmm.
right? And us starting to take control of our own health and rather than this idea of outsourcing our health, which I think has kind of happened in the past couple of decades
Hmm.
of saying, oh, okay, well, I don't know anything. And there's these specialists and they've been doing tens of years of doctoral school, then therefore they may know much more than I do. Well, in
Right.
reality, I'm living with my own body.
Hmm.
I'm the one that actually has to deal with these symptoms, and I track them or don't track them. I know when they come up, and then randomly I go to the doctor and they're no longer there. Right?
Always the case.
Where do you see health going? Where do you see research going? Because you mentioned that there's a long way for us to go.
Interestingly, I think research now I'm seeing all the ways you can monitor yourself and track yourself, the continuous glucose monitoring, the wearables, the wearable devices, the things you can do at home from testing, like blowing into something or collecting at home and mailing it off. I mean, it's become really exciting in the technology world of how much data we can gather about our own body just at home, just by doing something at home versus having to go in to a clinic, to an appointment, to a hospital, to something like that when you're just trying to gauge your everyday. Even something as simple as temperature tracking with your cycle, just small things that might be are normal, like yours and mine, but to when women learn it for the first time, like, you mean I can track my cycle and I can guesstimate, like if I can know when I ovulate? I mean, just like mind blow. I know when I ovulate. I'm like, yes, you can test this in the privacy of your own home. You can track your temperature. You can wear a device, like a ring or a watch or something that can tell you your temperature change. You can follow your symptoms. You can feel your mucus or not. And it's just like, oh my gosh. And then that just gives them so much more empowerment to know. And then they want to know more, right? Like, well, I didn't get those symptoms this month. What does that mean? Why is my period worse? Oh, I didn't get those symptoms. I must not have ovulated. What does that mean? What does progesterone actually do? What is this part of my cycle actually called? What's the luteal phase? And it becomes this whole scientific exploration, but about themselves. And so I see that whole technology realm just really exploding because people want answers. They don't want to rely necessarily on maybe their doctor they just can't provide every detail. They just can't provide 24/7 guidance. And so when a lot of these cool technology things can do it for us and help us, help guide us, help point us in the right direction, I just love it. I think the more knowledge is better.
And do you find that women are starting to get more open with sharing their own health information?
Yes, I think social media has really allowed that to explode, and it's allowed women to connect on multiple platforms, whether it's in chat groups, in Facebook communities, just in the comment section. I have women in my comment section that just go back and forth. They have these really great conversations like, this is what's working for me. This is what I've tried. What have you tried? What have you seen? Just about maybe just anything, any kind of topic. And as a result, by sharing and people who are creating entire accounts around whatever they're going through, just to share their story with the hopes of helping somebody, it's drawing in huge followers because those women are suffering the same. They have the same symptoms and they don't know where to go and they're struggling. Their typical route, their typical conventional medicine is maybe not helping them the way they wanted to or hoped. And so they are turning to these platforms to find a community to run checks and balance off of them. Like, these are the symptoms I'm having. Is that what you had too? You know, this is the supplement my doctor put me on. Are there known side effects or whatever it is? And I just find that really great and empowering for women. There's of course an extremist, don't get me wrong, right? Dr. Google is still Google.
Right.
And just because you're in an amazing chat room or, community doesn't mean that everybody in there is really an expert. If they're only giving you their experience may not be the same as your experience, right? And so that can be challenging. But what I love are that all these communities are so helpful. They're so helpful at like guiding and directing and suggesting and calming and nourishing women. I just love seeing that. I just love seeing the women's collective come together and be like, yeah, I'm not standing for this anymore. Like, I want to get healthy. Let's do this.
Yeah, exactly. I think it's, somebody asked me before of, do you think that there's an element of so many different things coming together right now that it's prime time for it? And what I mean by that, and I think it's absolutely the case, right? You've got, the Me Too movement that happened. You've got wearable technology. You've got communities and people wanting to share. You've got people just saying, I'm sick and tired of realizing that, pills are not going to be the answer, right? And it seems like, to me at least, it seems like it's been bubbling. And now all these different elements, all the different puzzle pieces are coming together such that it's time, right? And it's time to say, all right, let's not have a stigma to say, I am my symptoms and therefore feel like you can't speak about it. So, postpartum depression, something that I would say decade ago, women didn't want to talk about because there's sensitivity towards it, or there's, wait, what, you don't want to hold your child, or, so many different things.
Right.
And now I think women are starting to say, wait, there are so many different elements in the environment, that probably are impacting me and my hormones and how I'm thinking. I'm not my symptoms, and therefore I can probably do something about it.
Right. And you see it everywhere. I would agree with you. When you just watching the internet, right? Like you and me being really in the space, I'm seeing the questions of women posting all the time, seeking answers. And even though I can't give them medical advice every time, it is really encouraging to me when they're out there seeking. They're like, this is what happens to me. What does this mean? Where can I go? Point me in the right direction. Send me a podcast. What group can I join? I want to learn more. I'm not accepting the status quo. Like, this isn't working for me. I'm not settling. And I think that's really, really exciting. And you're right. I think it's like the perfect storm of events, but it's like a good storm. It's a happy storm. It's a storm with rainbows, and shining stars and stuff. Let's celebrate it.
Yeah, exactly. In terms of research as well, what from a women's research standpoint, I mean, one of the things that I was looking into before this is the history of research for women, right? And I think there was something that basically said that in the 1970s, childbearing women had been basically removed and said, you can't be part of clinical studies. And then later on in the 90s, it started to become, more apparent that women really aren't the same as men.
Right.
One case in point being heart attacks and how heart attacks present themselves in men versus women. In the early 2000s, I think it was, they noticed that women and men, while they were both being part of studies, or kind of 50-50, included in studies, the analysis was actually more skewed towards men.
Right.
So it seems like, there's an understanding, I think, that, in the past, we perhaps haven't researched women because there's kind of bigger fish to fry in the sense of bigger health issues, right? A health issue that impacts both sexes is obviously there's a better return of investment on that research than just, a subset of something just on PCOS or just PMDD or just something that's women's focused. But that's the history. Where do you see the future going?
I think it's really exciting. There's this saying that a lot of my colleagues say that women are not small men when it comes to research, right? And so we can't assume just because a man presented this way or a study says like, this is how it presents. You gave a great example, heart attacks. This is how heart attacks present, and blanketly say it's in all genders. And now we know that oopsies, that's not the case at all. Like actually the heart attack often presents very differently in women. And that's why women get blown off compared to men. Men get the chest pain, the left side radiation, the crushing pain. And women don't as much. They get a lot more like fatigue. And so it gets blown off. And all of a sudden she's had a heart attack. But there's a great researcher. Her name is Lisa Mosconi, and she's an all women's Alzheimer's researcher. And she's written a book called The XX Brain, and it's all about the female brain, how it works, how it's different, and then Alzheimer's. And it's so fascinating when she compares men to women when it comes to the brain, but men to women when it comes to the development of dementia and Alzheimer's, and how it's different, and how the female brain, of course, is very different from the male brain in a lot of respects. But she only focuses on the female brain because dementia and Alzheimer's is such an unfortunately hugely prevalent problem. But a lot of research is focused, and we think of, dementia. We used to just think of men. We would picture, like our grandpa or great grandpa, and Alzheimer's, and that's what was studied. And Dr. Mosconi was like, no, this, like with women, we really have to separate this out and focus on females because our hormone makeup is different. Our brain neurotransmitters they're the same neurotransmitters. They just act differently because our hormones are different because we cycle. And what does that mean? How do women respond? I see that more researchers stepping up to say, no, we need to focus on this diabetes in women, right? We need to focus on whatever in women. It could absolutely be a subset of PCOS or PMDD or postpartum or endometriosis, absolutely. But it could be a autoimmune disease and women. It doesn't have to necessarily include men. I'm not shunning men. I don't want people to think that. But I'm just seeing, just like you're seeing, more research go to how is this just affecting women versus assuming the study that was skewed to men is exactly how it's going to respond in women. And it's the same in pharmaceutical studies, right? So I will have women that will start a medication or whatever it is, and they will say, I'm having this side effect. And their doctor will say, well, that's not possible. That's not listed in the study. There's no way. And then they will post it online. I'm on this medication. I'm having this side effect. And all these women are like, me too, me too, me too. I am too. That's so crazy. Me too. They're getting validated. But it also, I'm like, I feel like that medication or drug or whatever it is probably should have included more women. And then they probably should have looked at symptoms, male, female. They probably should have looked at mechanism of action, male, female, because we're going to start seeing this more and more apparent. Women are not staying quiet. They're like, this is a problem. Yeah. So I'm excited for research in women.
Interesting. Is there a website for that to be able to call out whether you're having specific symptoms? Do you know?
Yes, there is. And it is escaping me at the moment.
Oh, we can just put it in the show notes.
I know. I was like, let's put that in the show notes.
Yeah, no, it's fine. Because I think that's an element, right, of even raising your hand and saying, I'm having these symptoms.
Yeah.
And the more people that speak out, you're right.
You can report it right to the manufacturer, the pharmaceutical company itself. You can report it to your pharmacy, your pharmacist. And I believe your pharmacist knows where to, report back to. I would say most, unless it's really severe, I would say most probably doctors don't report side effects. Maybe if they're noticing trends, if they're noticing like every single person who does this medication is getting heartburn, they may tell their rep, like, hey, I don't prescribe that anymore because everybody gets heartburn. And then it gradually gets back to the company. But as an example, but you can actually report it. You can actually get on the company's website and report side effects.
Overall, as an ND, do you typically try and prescribe more the natural route rather than prescriptions? Or
I try. So there's a time and a place. I'm not opposed to pharmaceuticals at all. And where I practice in Oregon, the state of Oregon, I have a pretty wide scope of what I can prescribe. Not all states are that generous to naturopathic doctors, but I have a lot of experience with prescribing. So if somebody needs something, like I'm really lucky that I can say, you know what, you actually do need this. I think in my best clinical interest, you actually do need this pharmaceutical. But I love that I can also say, you know what, I practice in a holistic point of view. I'm very personalized. Let's address diet, lifestyle, the basic stuff. Let's see what's going on. Let me go through your health history. Let me talk about chemicals. Let's try to replace nutrients, all the things. And then if in the end, I'm like, you know what, this isn't working, I think we need a pharmaceutical intervention, we can do that too.
And I like that because it's, to me, I find that there's so many people who are either on the full on kind of pharma train or the
Yeah,
natural train.
right.
And it's, in reality, there's probably is a place for both, right? There is,
Yeah,
if you don't have a thyroid, then you're going to have to take thyroid medication,
right,
right?
right.
However, could there be natural things? I think you talk a lot about like holy basil and
Hmm.
things like that, ashwagandha, things like that, that actually could be really quite beneficial, and you don't have to go kind of the drug route. You could take
Right.
something that's more natural.
When I was in practice, I had a patient who had come to me. She had severe pneumonia. This was obviously way prior to the current pandemic. And she had pretty severe pneumonia, and she was hoping for it. She was like, can't you just give me a supplement? And I'd listen to her lungs, and I did all the things. And I said, no, you're actually really close to going to the hospital. Your oxygen's dropping. Like, I need to get you on a pretty strong pharmaceutical regimen right now, or you're probably going to end up in the hospital tomorrow. So sorry, astragalus is not going to do it. Echinacea is not going to do it. Vitamin C is not going to do it. And we'll do the cleanup. And she was all concerned. And she's like, well, I don't want to be on antibiotics. It'll affect my gut and it'll affect this. And I was like, I 100% get it, but you're lucky. We will do cleanup afterwards. We will work on the gut. We work on the microbiome. We will work on all that detoxification. But right now, I'm trying to keep you out of the hospital. So priorities. And her husband was like, if the ND says to take the medication, like take the medication.
Yep. There's a time and a place.
There's a
Yep.
time and a place. But then you're right. Somebody says I'm really stressed out. I'm like, holy basil is a favorite go-to of mine. I'm like, you know what? It's over the counter. It's a great tea. It works really well. It's generally considered safe. Do you need Xanax? Probably not. Like, let's try this other route first. Xanax is great, but pretty addictive and got a lot of other problems.
Yeah.
Let's go with some of the natural routes just to help bring it down a minute.
Yeah. So, I mean, just kind of switching over, I really like what you're saying in terms of the natural route and the
Mm-hmm.
natural route of things. And, one of the things that you focus so beautifully on and are able to explain, I love your metaphors, by the way. I mean, the tub, it's easy, right? You
That's
make
how
it.
I think. So I'm like, well, I'll just tell everybody what I think.
Yeah.
How I process.
So yeah, I think maybe we can just shift over into your area of expertise or one of our areas of expertise, which is hormones, and kind of maybe just walk us through of 10,000-foot level,
Yeah.
hormones 101 and
Yeah.
hormone imbalancing. Because I think that's oftentimes when I have my girlfriends, they're saying I'm out of whack, I'm imbalanced. Are we just constantly in that flow and constantly trying to get ourselves into balance? And is it just one of those things where there almost is no such thing as balance and we just have to keep on going back and
Right.
forth?
We're just hoping for the best. So interesting you said that question. Like a year or two ago, I want to say my mom, who is my biggest fan, said to me, I love what you do. I love listening to you. I don't understand anything you're saying. And she said, and in fact, I don't actually really know what a hormone is, but you say that word a lot. And I was like, oh, my mom doesn't even know what a hormone is. And I have failed. I have failed my profession. First, what I tell people is that when we say hormone, it's just a little tiny chemical messenger. It's literally just a message. It's like a text message. That's what a hormone is. It's a physical text message that floats around your body and tells different things to go on or to go off and to do the things. That's what a hormone does. But when we as women say hormones, primarily we think estrogen and progesterone. But when the medical community is talking about hormones, we have multiple glands in our body that make hormones. We have thyroid gland that makes hormones. We have pancreas that makes hormones. We have obviously the ovaries and the testicles in men that make hormones. We have all sorts of hormone. We have brain hormones, right? We have all these different areas of our body that make hormones. And that's collectively known as the endocrine system with an E, endocrine. And those are all our hormones. So you could feel hormonal and it's your cortisol. You could feel hormonal and it's your thyroid. It's your estrogen. It could definitely be all of these. The interesting thing about your hormones, though, is they're never the same. They never flatline. They are in constant motion and they follow rhythms. So if your rhythm is out, if you're natural up and down in your day, or you're up and down in your cycle, as women, we go up and down in our cycle, is off, that's when we feel hormonal. So if our daily rhythm is off, if we don't get really good sleep, if we're really stressed out, if we can't fall asleep right, if we feel groggy in the morning, that's our cortisol rhythm. And so when we feel like, oh, I feel so tired today, I feel burnt out today, I feel kind of anxious today, I feel whatever today, I didn't sleep last night, that's cortisol rhythm. And so that is a hormone. So we can be hormonally imbalanced. Women say, I have PMS, I feel just hungry, I feel moody, I am bloated, I just feel really blah today. It's generally our estrogen and progesterone, because those work on a much bigger monthly cycle. They go up and down at various times in the month. So it's like a roller coaster, but it's a healthy route. It's the same up down all the time. There's no loop-de-loops. It's just the same up down, right? There's no crazy left turns. If your roller coaster of hormones does loop-de-loop or does left turn when it's not supposed to, then you feel it. Then you're like, what is that? I feel hormonal. Like, why was this month so much worse? Why is today so much worse? And so when someone says, I feel really imbalanced, I'm feeling really hormonal, I'm like, all right, well, something took a hard left or did a loop-de-loop, and you're not on your natural rhythm. You can have a healthy rhythm daily and monthly.
So it's almost like hormonal imbalance is a misnomer, because you don't really get any information from it, right?
Yeah.
In order for you to actually understand what to do, it would be, I am cortisol imbalanced, or progesterone imbalanced, or whatever, like a specific one of the hormones.
Yep. Thyroid, insulin, estrogen, testosterone, DHEA, all of these. They all go up and down. They all play like a big symphony in an orchestra. So they're not always on, but they're not always off. Women are amazing. Like the fact that we do this day in and day out, especially through our cycling years, our reproductive years, as it's called. And we should run the world, because we can coordinate this in our body. Imagine what we could do if we ran the world. Yep.
Now, men versus women in terms of hormones and hormone imbalance, right? Yep. Everybody talks about PMS. Everybody says, oh yeah, she's hormonal, right? I've never heard he's hormonal.
Ever. And they absolutely, every woman who has a significant man in their life, whether it's their partner, their brother, their business partner, doesn't matter. If I say, is he ever hormonal? They're like, yes. He won't admit it, but yes. We all know men get hormonal too. They just don't have that. They never got the stigma attached to them, and they don't cycle like women do, right? They don't get a period, but I have 100% asked my husband before, are you PMSing? I have 100% asked my guy friends before who are in a bad mood, is it the time of the month? And the funny ones are like, yeah, I guess so, because I am not in a good mood, or I'm not feeling it, or I feel unbalanced. And so
menstruating.
Exactly. Men absolutely can be hormonally imbalanced. Their testosterone also goes in a rhythm. Their thyroid goes in a rhythm. Their cortisol goes in a rhythm. Their glucose and insulin go in a rhythm.
So what is that rhythm? Is that also monthly? Is that
more daily? It's more daily, but they do say that men have a longer cycle. It takes about like 65 to 72 days to make a sperm. So you're making them every day, but like these big sperm cycles, are rhythmic. And so men kind of go in this, they're just sort of, their cycles considered longer than women, versus usually 28-ish days. Men can be longer, but testosterone is made every day in a rhythm. It's usually up. Testosterone in men is made in the night. And so like sleep is really important to them. So men who don't get very good sleep often wake up tired and grumpy, and, they'll have weight gain issues and libido issues and erection issues and motivation issues. And so same for cortisol. The men's cycle too, just a little different. In women, it's obvious usually, right? We get a period or we don't. And so it's easier for us to check in, whereas there's no like check-in for men. There's no like let go for men to tell them.
So it's almost more difficult for them to some extent, potentially, because there isn't an obvious cycle that they quote unquote should be following.
Right.
And there isn't a bleed, or there isn't other things that are external factors that show them.
Right. But usually it's the women in their life who can say, oh yeah, he's hormonal.
Yeah.
And just like there are women who don't have hormonal issues. I definitely have women that are very in sync and doing great and very asymptomatic, no issues. And, men can be too. They're doing great, feeling great, working hard, and it's not affecting them. But for a lot of women, our roller coaster takes a hard left easier, because we're gender that's supposed to continue the species, right? Reproduction. And so our brain is constantly scanning us for threats, for stress, and to affect our reproduction. Whether you want to get pregnant or not, I don't care. Like, that's not the issue. It's just, we get a cycle every month, and there's so much feedback to the brain, to the hypothalamus, like, ooh, she's kind of feeling threatened and stressed out this month. I'm not going to make her ovulate. I'm going to protect that egg, not release it, because this is probably not the month she should get pregnant. And that sets off a cascade of hormonal changes. And as a result, we feel hormonal.
Yep. So basically, in this time right now, we're filming this within the corona pandemic. So right now, it very plausible that women are going to have issues
Yeah.
or changes within their hormonal cycle because we are so stressed, and the environment right now is not conducive for our bodies, or at least our bodies are saying, hey, you know what, maybe right now is not the time to get pregnant.
And so many women, I've put it out in social media, and I had so many women that are like, oh my gosh, I thought something was wrong with me. I was 2 weeks late, or I was a week early, or my PMS was atrocious, or my endometriosis was horrible this month. I thought I had everything under control. I'm like, you did. You totally did. It's not your fault. This little virus is, causing problems in more than one area.
Yeah, I've noticed that for myself, I feel like I've got it all covered. Everything's great. And then I'm noticing that my sleep is just horrendous.
Yeah.
I just like you, I track my sleep, and it's just, I'm noticing, those sleep patterns, my deep sleep, my REM sleep is just completely off kilter. So while I think I might have it all under control, then my body is saying,
Your subconscious is like, that's cute. No.
Yeah, exactly. So what kinds of, I guess, misconceptions or things that are out there that, women or men think that they know about hormones? What are those misconceptions that you'd like to change, or that you would just say, listen, that's a complete no?
Oh, that's a really good question. I think a lot of questions that I get are like two areas of life, either what's considered a normal period, and then what is this thing called perimenopause, because nobody taught me about that. And so I find in general, women's health is not very well taught in school. And actually, to go back to your first question, I think understanding women's health, how our bodies work 101, a lot of women are discovering for the first time as adults. I get that feedback a lot of like, why didn't I learn this at 16? Or why wasn't I taught this when my period started? Or how come nobody in college said, you know what, this is what's actually happening, because I'm learning this finally as a 40-year-old. I'm like, yeah, why is this so taboo and hidden? Like, it's billions of women are doing this every day. So I don't see what the problem is, just to say it.
I was going to say, one thing that just fascinates me is that, in middle school, we learned how to balance physics equations or, chemistry equations, right? How many times have most of us used that? Yet how many times do most of us wish we knew more about our period, right?
Yeah,
Or what's right, what's wrong, what's normal, what's not, what's, what should we, again, should is a in quotations, right? What should we be feeling? But yeah, like, why is it that women's health 101, right? Not even getting down to the metabolites, right? But like 101, why is that not included in our middle school or high school education?
I have a lot of theories, but they're controversial. There's just so many moving parts, right?
Hit 'em.
So many moving parts to sex ed is not, well, I grew up in the South, so sex ed was just, you did not talk about that, right? Like, Jesus did not want you talking about sex ed. That was going to be left to the church and to your parents. And when sex ed was allowed in the school I went to, it was taught by the football coach. No joke, the football coach, who was ridiculously inappropriate. I tell this story, and I've told it before, and other people have other just similar, they either went to Catholic school or they went, to whatever school. It just was voted out, sex ed, they didn't know, or maybe they got some basic health stuff, but they weren't allowed to say the word vagina, or they weren't allowed to say, whatever. And so it became this super taboo subject because the parents and the administrators made it really taboo and fought about it. And so when the parents and the administrators of the school are fighting about it, then it suddenly, to the students, it's like, oh, well, if mom's upset and the principal's upset, like, clearly this is not a subject we should discuss. And on the flip side, I'm like, no, unfortunately, this is a subject we should discuss from a very young age. Just basic anatomy and basic physiology 101. It is what it is, science. It is what it is. These are how the ovaries work. This is how a boy makes testosterone. Like, this is what a period does. This is how a woman ovulates. I have so many women, when I tell them, roughly in the middle of your month, you're going to release an egg, and that's known as ovulation. And they're just like, really? Like, yep. And then when you release that egg, the hormone that's made is called progesterone. And that's when you make progesterone. You have to ovulate to make progesterone. They're like, I don't make that all month long. I'm like, you don't. You actually only make it in the second half. And the second half is called the luteal phase. I have halves to my cycle. Like, you do. And I'm not making fun of them. Because it's so rampant that the misinformation, it's getting better. Women are getting more educated, but I've had a lot of women that you said this earlier off camera. You know, when women are like, well, what's the follicular phase? I'm like, yeah, I get that question a lot. Like, is that before my period or after my period? I'm like, good question. It's the part after your period.
I love what you just said in that, what if people were more educated?
Yeah.
Imagine, I mean, yes, I mean, I grew up and, you know, you don't talk about your period.
Mm-hmm.
You don't, you know, because it's icky, it's strange, it's just nobody wants to hear about it.
Yeah.
You know, like there's shame associated with it. I mean, there's a lot, right? There's a lot of, I mean, go
So
on to
much taboo. Yeah.
you know, the psychology of it as well. I feel like, at least in the circles that I'm now speaking with, it's very, very interesting to me, because I think that there are a number of even men out there who are saying, actually, it would kind of be nice to know, because then I know when you're going to, you know, be hormonal. I'm going to know when, like, to leave you alone, right?
Yeah.
And it's and there is elements to it of, well, what if it was included in the dialogue? Yeah, fine. You don't need to go into details about it if you don't want to, but even in an office setting of just saying, hey, listen, guys, like, I'm going to be working from home next week. You know, I mean, especially right now, seeing how a lot of us are working. I mean, the vast majority of people are working from home, and that seems to be working. You know, what if we could say, hey, listen, I'm out, you know, because I need a little bit of space and time. And anyway, but
I agree. I mean, men, 100%. There's a grown man that I know. Somebody said she had her period, and he said something about bleeding out the placenta. And she was like, no, that's not what the period is. And he's like, well, don't you make a placenta every month and then bleed it out? She was like, no. Nope, the placenta is the part that would go around a baby should I be pregnant, which I'm not. And because I'm not, I'm actually just bleeding out tissue that was built up if I were to be pregnant, but I'm not. So no, there's no placenta every month. And he was floored. Don't you make a placenta every month? No. We all completely laughed. And then we were all like, oh, a grown man didn't know this. He had never been taught. He never looked it up. He didn't care, right? And he just thought that's what women did when they said they had their period, is they let out a placenta every month. And I was like, no. Oh, wow. We have a lot of education to do for men. We should start there.
Yeah, exactly.
Men knew.
And also, I mean, even the education of, you can't get pregnant every single day of the month, you know?
That's a big one.
That's a big one that I think a lot of young girls don't know, and probably young guys don't know as well. Yeah. So it seems like we have a lot of educating to go.
Yes. See, I'm all about that, like 101. If we could just start with the 101 for a lot of men and women, that's sort of the big thing that I see.
So yeah, you were saying about kind of misconceptions with hormones. So there was an element of perimenopause as well, right?
Perimenopause. Funny enough, I had a colleague of mine practices in California, and her patient told her, and then she passed it on to me because she thought it was hilarious. Her patient's OBGYN said perimenopause doesn't exist, and all women go through menopause at 51 years old, give or take. And I was like, if I knew for a fact I was going to go through menopause at 51 years old, give or take, I would be beyond thrilled to know a date. Millions of women in this world would be like, 51? I know a date, because so many women are like, well, how long does this last? When does it end? When does it start? Like, how long? I'm so symptomatic. And if I could be like 51, give or take, I'd be so happy. I'm like, first of all, it does exist. Second of all, no, women do not go through menopause at 51, give or take. I have women that have gone through menopause, unfortunately, at 39. They go through premature menopause. I have women in their 40s who are perimenopausal. I have women in their 40s who have stopped bleeding and are menopausal. I have women in their 50s who are perimenopausal. I have women in their 50s who have stopped bleeding and are menopausal. The classic definition for menopause is to go 12 months without a period. 12 whole months without a period. Now, usually it's, of course, age related. So if somebody listening to this is like, well, crap, I'm 26 and I've gone 12 months. You're probably not menopausal. You probably have other underlying things going on. But if you're in your 40s or 50s and you've gone 12 full months, no period, you are now considered menopausal. And then you'll continue to hopefully have no period. But perimenopause is that like weird roller coastery part between I'm not really reproductive anymore, so I'm transitioning into menopause, and now I'm getting the hot flashes and the night sweats and the irregular cycles and the weight gain and the brain fog and all the like super awesome symptoms that women
we can all look forward to.
We could all look forward to, exactly. Or a lot of us. The other big misconception, I have so many women that write me and go, nobody told me about perimenopause. Nobody taught me that this is going to happen. I thought something was wrong. I thought I had cancer because I was having hot flashes and night sweats at night because I Googled it and that's the first thing that shows up. 45 years old with hot flashes. Oh, you have cancer. Or you're perimenopausal. Or it's your hormones. And I wish women had a much better understanding of how to prepare themselves. I wish women knew that prepare yourself for perimenopause so it won't be hopefully so crazy, is to start in your 30s. I mean, your whole life, of course, but like as you get closer to 40, you have to be really diligent with all of your self-care, your sleep, your diet, your stress management, all those things, because you can't continue to push the boundaries of your health when you hit your 40s. And I heard that from so many patients over the years. I'm 42, right? And when I was younger, my patients would say, I hit my 45th birthday and it all fell apart. Or I hit my 50th birthday and it all fell apart. And I was like, no. And then I hit 40 and I was like, damn it.
Yes.
Are you serious? And I joke to my husband, like if I get hot at night, I wake up in the morning. I'm like, was it hot in our room last night? Did you get hot? And he'll be like, yeah, it was really hot last night.
Good. Not yet. Not yet.
Not yet. Not yet.
Yeah. And it's true, right? I feel like we have these different stages in our lives, right? Like when you hit 30, all of a sudden you can't be drinking as much. You can't, or maybe,
no, it's
not
true.
for everybody, but
true.
right.
So,
I know my hangovers are horrendous now. I noticed that weight gain is a lot easier. I noticed that, it's a lot more difficult to just say, oh, well, that's, a couple pounds that I want to shed.
Yeah.
And it's just as we get older and older, it just gets progressively more difficult, unfortunately.
100%. And nobody teaches us that, right? I know I wouldn't remember it in middle school or junior high or high school, but like if we just kept a program, if we just kept on it little by little, just breaking up chunks of Hormones 101. And by the time you get into college, women now are so much more in tune and so much more educated than they were when I went through college. And so it'd be just so helpful to know, like, look, you don't need to know this now, but just know, like, these are the changes that are going to come. Mm-hmm. So when you feel them, just remember this day and this class, and this is what you need to do. Like this is normal and this is not.
So what would be those 2-3 tips that you would say for, a young girl, a girl who is, just starting along in her cycle?
I feel like that's a whole book. No, I'm just
That probably
kidding.
is. And we can pause on that and we can just come back in another episode of some sort.
Honestly, what I would tell a young girl is I would explain to her what I would consider maybe more like normal, like you said earlier, should in quotes versus not normal. So the number of women who have severe debilitating pain every month and they think that's normal because that's all they've ever known. And I'm like, that's not normal. I'm like, severe debilitating pain, not normal. Women who just bleed through tampons and pads or cups or whatever, and they just think it's their normal. And I'm like, that's not normal. That much blood loss, there's a reason we have to do something about it. These, PMDD, right? Like just things that I don't want women to experience, or I don't want women to think, well, yeah, every month I get so depressed, I can't leave my house and I have really dark thoughts for a day or two and then it gets better. I'm like, that's not good. Like that's a huge key that something is going on those 2 days or the days leading up to those 2 days. And we can work on that. There's things we can definitely try to help and implement and test for and try to improve that. I don't want you to go through that, and at least get women from a 10 out of 10 symptom, maybe to a 3, right? Like I get PMS. Am I going to ever get rid of all of my PMS? Probably not. And that's cool, but like it's way better than it used to be. My cramps, do I get cramps? I used to have severe cramps. I would throw up, or at least feel like I was going to throw up, sweating, the whole thing. And now, I'll get cramps sometimes and I'm like, okay, cool. Yep. Like gentle reminder. Got it. All right. Will I ever completely get rid of my cramps? Probably not. But I'm okay with that. So these are the things I would tell a young woman, like, here's what to expect. And if it's outside of this kind of bell curve, we need to get you some balance other than the birth control pill.
You just read my mind.
I know.
You just read my mind. You just read my mind. Yeah.
Ready to spit it out.
To me, that seems like the current status of, it's just a Band-Aid that a lot of young women get. And after hearing what Sarah Hill talks about with, the fact that the brain is still developing up until 22, 25, and you have a young girl, she says, all right, my period is really horrendous. What do? I can't get through school because I'm so stressed, or I have such dark thoughts, or my bleed is so horrendous, or what, fill in the blanks. And then all of a sudden you say, okay, here's the pill. Now, if that's the case and she's 18, then from 18 to 22, she's being pumped full of these hormones, these xenoestrogens, and her brain, again, is still developing. So what is that link? Where are we messing that up for her future, for saying, okay, once you do get off the pill, if you do get off the pill because you've decided that, for whatever reason, are there the reverberating effects of depression or, other things that are impacting your mental health for years after you deciding to get off the pill?
Yeah, absolutely. Post-birth control syndrome, right? That Dr. Jolene Brighton has coined the term and written the book because she just kept seeing it over and over and over again of these women who were on the pill and very symptomatic, or had come off the pill and were very soon pretty symptomatic. And it was very kind of classic over and over and over again. And so that's what led her down that path of, wait a minute, I don't think we know to the full extent what the birth control is doing to women's everything. I don't think that's been fully studied the way that it should have. I'm not against the pill, the IUD, none of that. I'm not against any of that for reproductive rights, but I do feel like the risks are not well explained to women. What to watch out for are not well explained to women. And I think when women have symptoms, they're often blown off as something else. If you go on the pill, but you end up with a lot of GI symptoms, you're not sent back to your OBGYN, you're sent to a GI doctor, and now maybe you're put on another medication, like to manage your, whatever it is, your heartburn, your IBS, your whatever you've got, and so or maybe it's depression. You go on the pill and you find that your mood really tanks. You're still not sent back to your OBGYN to reevaluate the pill. You're sent more to get an SSRI, right? Something brain or psych to help with the depression that you're experiencing. I wish those were more explained to women, even young teenage women, like, hey, look, I know you want the pill right now for whatever reason, even if it's their request, but if you get these symptoms, you need to let me know because we need to reevaluate what's going on. Don't be afraid. Just let me know so that we can talk about other options or what we can do or maybe how it's affecting you moving forward.
I like that approach of, listen, be informed. Don't say that it's an absolute no. Just say the same thing with pharmaceuticals, right? Or just say, don't say absolutely no to these things. Just be informed of what the potential repercussions could be. And if you do have a symptom that flares up, then let's talk about it. Let's figure out something else. Because frankly, it's that immediate pleasure or that immediate, Band-Aid of I need to just fix this for now, not realizing that there potentially is going to be reverberating effects for the next 20, 30 years. And also, by the way, reverberating effects for your reproductive capabilities. Right now, this is solving your problem today, but is it potentially causing a future problem that is going to impact you quite a bit as well?
Absolutely. And also, one of the things you asked earlier about things that I wish, like they assume, but I wish they knew, like the birth control pill. When you're on the birth control pill and when you bleed, it's not a period. And I think a lot of women don't understand the mechanism of action of the birth control pill. What it does when you take the birth control pill, it works great because it tells the brain not to make hormones, not to make your female hormones. It shuts everything down. So these two hormones called FSH and LH, and they go down and talk to the ovaries and tell the ovary to make estrogen and progesterone. That all gets shut down. So your own hormonal production gets taken over by the pill. The synthetic estrogens and progestins in the pill take over. Now, when you stop the pill, when you're on it and you stop it for those 7 days to get your quote period, it's not a true period. It's not a period of like when you were cycling before at the direction of the brain. It's called a withdrawal bleed. So you stop the pill and the uterus just sheds as a result. It's a withdrawal from being on the pill. And then you go back on the pill and start over again. So I will have women say, I went off the pill and I stopped having my period, but I had a period every month with the birth control pill. I'm like, it wasn't no, you didn't. It's actually a withdrawal bleed. It had nothing to do with your brain and your ovaries. And now that you're off of it, off the pill, your brain and ovaries have not woken back up yet. And so you don't actually get a menstrual cycle. You're not cycling. You don't get a true period because the pill had taken over. And it's like mind blowing to so many women who go, I had no idea that's how the pill worked. I did not realize it was shutting down my own hormones. Yep. It's how it prevents you from becoming pregnant and does things like affect pain and how heavy you're bleeding and things like that.
So the withdrawal bleed, that has nothing to do with your progesterone increasing over the course of the second part of your cycle, because you're not going to increase progesterone because you haven't ovulated.
Correct.
So then you're shedding what specifically, though, in a withdrawal bleed?
So you still get tissue. You still get tissue buildup in the uterus at the direction of the pill, but it's so well orchestrated by the pill that when you stop the pill, let's say you choose to go off of it for whatever reason, that orchestration's been taken away. Like literally the conductor has walked out. Everyone's just like, I don't know what to do. I don't know what to do. As a result, you don't get that tissue buildup anymore. You don't cycle. You don't get the tissue buildup and then the bleed, and then the tissue buildup and the bleed. You don't ovulate. So if you don't ovulate, you don't release an egg. If you don't release an egg, you don't make progesterone. Now your uterus can't be thick and fluffy. And so it's just this whole domino effect. So the pill still allows you to build up tissue in the uterus, but it's at the direction of the pill. And it's definitely not to encourage implantation of any kind because it's the birth control pill.
What do you say to women who say, well, actually, it's quite nice that I don't have a bleed? You know, there are certain women who aren't able to cycle or who are not cycling currently. And they say, actually, I don't find that to be that big of a deal. You know, I'm okay with it.
The not bleeding part is not the part that I worry so much about. It's the fact that they didn't make the hormones in the beginning. So in the first part of your cycle, you're estrogen heavy, and we need estrogen as women. Obviously, it's like Goldilocks, like too much can cause a lot of problems and too little can cause a lot of problems. Well, if you don't cycle at all, let's say you have what's called amenorrhea, you go months without a period, then you don't get that estrogen, and that affects, you need estrogen for your brain, for your bones, for your collagen in your skin, for your joints, for your vaginal health, and. So if you're losing out on that estrogen in the first part, and then you don't ovulate, so you don't make progesterone. Progesterone is what's known as our progestation hormone. It's what makes everything feel calm and relaxed and easier, less PMSy in our second half of our cycle. It helps reduce bloating. It helps with our skin. It helps with sleep. It helps with mood, it reduces anxiety. And now you're missing that. So the fact that you don't actually bleed is not the problem. It's the fact that you don't make any of the hormones before that. I want you to make all of the hormones before that for your ongoing long-term health. That's the scary thing. And we see young women, for a variety of reasons, whether it's extreme athleticism or under-eating or PCOS, polycystic ovary syndrome, right? They maybe skip several months and they're more at risk for bone fractures, right? Because they're not getting that estrogen to their bones. So we have these young women who have a lot of bone issues. They have a lot of joint issues. They have a lot of sort of like memory brain issues. As we get older, it affects our heart. Estrogen's really helpful to protect us against cardiovascular disease. You may not notice it at 22, but you're going to notice it at 52 or 62.
So that brain fog that we're experiencing when, you know, you're sitting at the laptop, just doing your work and you just completely forget what you were doing or why you were doing it, that could be potentially tied to the fact that you didn't cycle that month.
It could. Estrogen has a lot to do with brain function. We have estrogen receptors all over our brain in different areas. Estrogen helps a lot with our neurotransmitters, the hormones in our brain, and how they are made, how they signal, how they, get metabolized. Mm-hmm. And so estrogen is a key component for that. So we miss out on estrogen, we can miss out on a lot of that. Like, for example, too much estrogen, being estrogen dominant, let's say, in the second half of our cycle, when we're close to our period and we have too much estrogen compared to progesterone, estrogen can reduce the amount of serotonin we make. Serotonin is traditionally tied to, it's our antidepressant hormone, right? One of them. And so if you're estrogen dominant, what happens? Well, you tend to feel more moody as you get close to your period, and you're more either angry or weepy, or you're both. But on the flip side, if you don't have enough estrogen, you can't make serotonin. So now you have the same symptoms again if you skip periods, or maybe as you get older and you're perimenopausal or menopausal, and you notice, like, what the heck? Why am I more depressed as I hit my 40s and 50s? I didn't used to be this depressed. I didn't used to be this anxious. What is this about? It's because you need those hormones in your brain to help support you.
And I think estrogen also gets a tough rap also, right? It's
I know. Poor estrogen.
Right. I've read a couple of books in terms of kind of xenoestrogens, and there's, everybody talks about soy and how that's not necessarily a good thing, and we're eating too much soy. Right. So can you just talk to that? I mean, what is the truth behind it? Is it really something that we should be concerned about, or I mean, I'm sure that the answer is depends, right?
It depends, right? It depends. Yeah. The xenoestrogens, yes. So xenoestrogens are the chemicals in our environment, the toxicants in our environment that look like estrogen. And so a lot of them will connect to an estrogen receptor and like a key and a lock and turn it on. So maybe your body doesn't want it to be on at that moment, but you got exposed to or had a lot of plastic. You drank out of a hot plastic water bottle, got all that phthalate in you and BPA, and now that all goes to your estrogen receptors and turns them on. And so that can affect everything, your cycle, your period, cancer risk, lots of stuff. And so we have to be careful with xenoestrogens. Some of the xenoestrogens out there will actually increase the creation of estrogen. There's a fertilizer called atrazine. It is known to increase the production of the conversion of testosterone into estrogen. So it actually makes us more estrogen in our body, which a lot of women don't need. We have plenty, thank you. And so we have to be very careful with these xenoestrogens. Now, soy absolutely gets a bad rap. I'm definitely biased against soy because I'm actually allergic to soy. I can't do soy at all. Not intolerant, I'm straight up allergic. So, which does make me sad because I would love to have like edamame sometimes. I would love to have miso soup sometimes. I would love to have tempeh, but no, that would be a really bad thing. So when I tell people, if they're like, well, can I have soy? I'm like, I suggest try to stick to the organic, try to stick to the GMO'd, even though pretty much at this point all soy is, but try, right? And so tempeh, the soy, the edamame, and maybe don't soy everything because we have soy milk and we have soy butter and we have soy yogurt and we have soy protein powder, we have soy bars and we have, soy ice cream, and we've like literally, you could just like bathe in soy if you wanted to. And so like that might be a little overkill. Be mindful and don't convert everything you have into soy. That would be my suggestion because it can be, I think phytoestrogenic depending on, dose and
that, and probably skincare products as well, right? Which have a number of different things that we don't even think about. I mean, our
personal
skin
products, personal product, all of it, shampoo, conditioner, any kind of like gel or mousse you put in your hair, everything, your cream, your eye cream, your body lotion, your hand lotion, your lip balm, what you clean your house with, all of that, your detergent, your dishwash soap.
Yeah. I just recently saw, I think it's called EWG, which is the Environmental Working Group, I think it is, which you can actually find a product or on their website and they can give you, Skin Deep, exactly. They can tell you whether the product is good, not so good, whether it's got, a number of different things that are going to impact your skin and potentially be absorbed through your skin and then impact your hormones, right? And it's really easy to use. Just it gives you like 1 to 10, I think it is on a scale. And so just try and stick at least to the 1 to 3, kind of the best ratings. And then at least that part of your, kind of regimen is a little bit cleaner.
And you can see that becoming more environmentally friendly, less toxicant is really catching on. You will see traditional makeup companies and shampoo companies that have their standard line and then they have their green line, right? That's phthalate free and this free and that free and fragrance free and all this free because the consumers are demanding it. Women want their Clairol shampoo, but they learned that all this chemicals in it are probably not good for them. And so they're now, this brand has their green line and they have all the no, we don't have sulfates and parabens and phthalates and all this stuff on the front. And so the consumers are, and you see it in conventional, I'll see it in Costco, I'll see it in Walgreens, I'll see it in Target, I'll see it in, it's becoming much, much more mainstream. Whereas it used to be, you have to like search the internet to try to find clean makeup or clean skincare. And now it's pretty common.
Kind of similar to how foods have been, a lot of folks have said, look at your food, see if there's less than 5 ingredients in there or less than 10 ingredients, and make sure that you can actually understand what they are. So a similar mindset being towards skincare as well. Right. I mean, some of the things that I was using, had 20 different ingredients in there. And it wasn't just, the fragrances. It wasn't just the other things. It was the emulsifiers. It was the things that was keeping the components together, and then also the preservatives so that it could actually stay on the shelves for months on end. I noticed that in my own products and slowly but surely just getting rid of them. I mean, it's an element of the more that we educate ourselves, not just getting frightened by it, because I find it very, very easy to just get either really scared about it or not know what to do, get this sense of paralysis of, well, I've been duped, I've been lied to, go down that kind of negative mentality rather than saying, okay, I'm lucky enough to have gotten this education, right? I'm educating myself, and slowly but surely I will weed out the things that don't work for me anymore.
Right. And just try things one at a time. Start with water filtration. Just you drink water every day, you cook, you're in your home. We're all in our home now. So, buy a water filter and start filtering your water. I was reading on social media, and I wish I could remember whose post this was, I would credit them, but they were saying how they had a client who just they were having a lot of hair loss. And they heard a podcast about how filtering water is so important. So the one thing they changed was they bought a filter for their shower, a water, like an attachment, and then the shower head comes in. So the water goes through the filter and then out the shower head. And they said that one change of filtering their water, they didn't realize how bad their water was, stopped their hair loss and their skin got better. And that just sort of like baby stepped them into, wow, okay, what does this mean about the water I'm drinking? What does this mean about the things I put on my body? But the one thing they changed was a shower filtration, which are pretty inexpensive. You can get them on Amazon, and just get out the chlorine or get out whatever's, in your city water and, or country water going in. What happens, because people don't realize that when we get hot in the shower, that everything opens, our pores open and our follicles open, and then whatever chemical happens to be in the water, even though it's deemed safe, it gets poured right into our pores and our follicles, and that can really affect some people's hair, skin, and health. And so, it doesn't have to be like you were saying. It sounds very overwhelming, and I tell people just one at a time. When you run out of your laundry detergent, like buy a new one, but read labels, look up online, ask your neighbor, call your sister and see what they're using. Get on Skin Deep or Environmental Working Group and look. When you run out of your toothpaste, do the same thing. Okay, when you run out of your deodorant, like just step-by-step process, like, okay.
And I feel like one of the things that I've noticed in a lot of your posts is you talk about kind of the importance of light, water, magnetism, the importance of a circadian rhythm.
Yes.
Can you touch on that?
Yeah, it's like probably my favorite. When people ask me what my number one, health hack is, I'm like, it's free, it's easy, use the light in the dark, it solves a world of problems. So our brain works on a circadian rhythm, which means we are creatures who are supposed to be up in the daylight and down in the darkness, right? At nighttime. So that's a natural rhythm. We're up in the sun, down with the moon. So what sets your circadian rhythm is this group of genes called the clock genes, appropriately enough. And they are entrained by the light. So we need light first thing on waking. We want full spectrum light. We want sunshine. We want brightness, a full spectrum light bulb, not fluorescent, but full spectrum. That's what we're going for on waking. So I tell people, open your blinds, open your curtains, go outside for a couple minutes, turn on your full spectrum light box and get exposure for 10, 15, 20 minutes to the light. That's what entrains these genes, that you get your butt up in the morning. When you get your butt up in the morning, what it does is it sets off a cascade to reduce inflammation, improve blood sugar, help with alertness, set memory from what you did the day before, which is great, reduce autoimmunity. It does all these cool things. At night, the darkness is what resets a dysfunctional circadian rhythm. Like, think the easiest example is jet lag. You travel somewhere, you travel from the East Coast to the West Coast. That's a 3-hour backwards, change for you. You get jet lag. So what you need are the light and the dark to entrain you to where you are physically, geophysical location, but reset the fact that you're totally disrupted. You're 3 hours off. The same can happen though in your own house. You go to bed late, you don't sleep that well, right? You wake up multiple times. And so you get a completely dysfunctional rhythm. And so you use the light and the dark to reset it. So sleep in complete darkness, wear a sleep mask, cut out all the lights, make sure your neighbor's light isn't coming in through your window, evaluate all that stuff. And it can be really, really helpful. And the earth, turns. So we're going to get light and dark. You can't really help it. So just use it to your advantage.
So what do you say then to those people who are saying, well, I'm a night owl. I like to stay up really late. I get my creativity then. I go to bed until, at 2, 3 in the morning. And then I'm a night owl. And so therefore I then wake up at 11 o'clock in the day. What's your thought on that?
So there's a whole sub-study of the circadian rhythm, where they look at those people. In fact, I think there's a book, and the name is escaping me. You take a quiz and he calls you by different animals. So you
can be a wolf, a dolphin.
Yeah, so I'm a lion.
Yep, a lion.
I'm a lion. Yep. And so, which means I'm not a night owl. I function better sort of in the morning and then through the day. So for the night owls though, I just ask them, like, what are your big symptoms? What's going on for you? How are you feeling? How is your inflammation? How is your infection? How is your autoimmune? How is your blood sugar? How is your alertness? Everything is fine. Like, they're like, yeah, I do great. I wake up at 11 and I do great. I'm pretty alert pretty quickly, what have you. Then I'm not so worried about them. Who I'm worried about are the people that are struggling. They stay up late, they push it late. Like, let's say they're not a night owl, but they're an entrepreneur. Let's say they're not a night owl, but they're a parent who puts their kid to bed and then gets their second wind and continues to do whatever at night, either, pay bills, get on the computer, watch TV. That's the late at night, work their business. And so they're a forced night owl. And then they get up in the morning and they're exhausted and they aren't functioning well and they have autoimmunity or their joints hurt or they just feel inflamed and puffy. Their blood sugar's all off. I'm like, okay, the night owl thing is not working for you. We need to follow the real circadian rhythm in that case. I need you to stop getting your second wind and stop continuing after you put the kids to bed, after dinner. I educate this the most probably to entrepreneurs because we're the most guilty, right? We're just always on, often always on, and it can affect our sleep.
I think that's a common thing, especially with women. I really do. I mean, I'm biased, I suppose, but yes, with entrepreneurs, with women, it's okay, I need to go. I need to kind of be everything to everybody. And yeah, so I find that there's a lot of women who will tell me that, they're going through the day and they're exhausted through the day. And then around 6, 7 p.m. at night, all of a sudden, they just skyrocket and they have a kind of energy that they say, okay, I can't go to bed at 10 o'clock at night. So what's the protocol? What would you recommend? Not as a doctor. I mean, obviously it's not medical advice.
So for them, I'm still working with the light in the dark. So I'm like, look, when you get up in the morning, I need light exposure on you immediately. I need you to go outside. I need you to open your drapes. I need you to use a full spectrum light box, whatever you do. And whatever you do, whatever your practitioner has told you to take, let's say, whether it's, supplements, it's a multivitamin, it's B vitamins, it's adaptogenic herbs that help with, stress response and stress resiliency. You do it in the first 30 minutes of waking. So you do it right away because you want to entrain your brain that in the morning, I get up. In the morning, I get up. Like that's where, and it's going to take time to try to entrain this. Now, for everyone listening who goes, well, I take my thyroid medication first thing in the morning. Yep. You still do that. Still take your thyroid first thing in the morning. Wait 30 to 60 minutes and then do all the morning supplements that your practitioner told you. Your thyroid is a diva. She has to be the only thing in your stomach. So let her be a diva, let her absorb, and then take your supplements. But if you're not on thyroid, then take it right away. Take your supplements right away. And then at night, you get this second wind. So now, let me back up. Through the day, now you have to be very mindful of what are you eating? Is your blood sugar all over the place? Do you go from hungry to hangry? Do you drop? Do you get that mid-afternoon, fatigue and you're searching for coffee and you're searching for sugar? Just be very mindful. Are you on energy drinks? Like be mindful of those things because those are all actually backfiring and messing you up. And then you get into the night time and now I need you to do the wind down stuff. So wearing the blue light blocking glasses, right? Getting off your phone and your screens a couple of hours before bed, doing stuff like not turning every single light on in the house, start to bring it down a little bit, looking at calming supplements before bed, magnesium, holy basil, which is Tulsi, chamomile tea, all those sleepy time teas we see in the market, get them, drink them, use them. Milk thistle, great for the liver. Be careful of alcohol, speaking of which. So what will happen, especially now and what's going on, is that people are drinking more, right? So they're at home and they're stressed and they're like, I'm just going to have a glass of wine to take the edge off or just to socially distance with my glass of wine. And what they don't realize is that alcohol and that sugar is affecting how we process through the night. And it can be very waking, especially as women get older, right? They hit their 30s and their 40s and they're like, can't handle alcohol like I used to. I'm like, I know, sorry. Sorry about that. Maybe knock that off, maybe be careful in how often you're doing that. Be careful of sugar before bed. It's your blood sugar up and then your blood sugar down, and that's going to wake you up. And so I'm doing a lot of mindful things with these people to train them that they get up in the morning and they go to bed at night. And just like we said earlier, and I agree with you, I think a lot of women are the caretakers of their household even. And so they get that burst of energy and they're like, okay, now I'm going to do laundry. And now I'm going to pay the bills. And now I'm going to wipe up the kitchen. And now I'm going to prepare for tomorrow. Okay, now I'm going to meal prep. And if you're homeschooling now, you're now I'm going to pick up after the kids. Now I'm going to get ready to homeschool tomorrow. And now I'm going to get ready for work. And now they're all like jazzed up. And then all of a sudden they're like, okay, it's 11 o'clock. Somehow I need to go to bed. And it's hard for a lot of us to go from do it mode and like on it mode and type A mode to now I need you to be calm and relaxed and go to sleep.
Yeah, exactly. I think Matthew Walker, who wrote the book, Why We Sleep, he says it beautifully of saying, we have a wake up routine usually, right? You wake up in the morning, you brush your teeth, you've got, you have your coffee, whatever it is. We as adults don't usually have a wind down and go to sleep routine. We had it when we were kids, right? You would bathe your baby, you have night, like
Right.
you have
You read a
sleeping
book.
book. I mean, exactly. And
You
why don't we do
snuggled.
that now?
Yeah.
Why is that? It's work, 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 work. And then all of a sudden 11 o'clock or whenever your bedtime is, which is usually just at the point of exhaustion that you just say, okay, I'm out for the day. And then you expect that you're going to be able to fall asleep very
Mhm.
quickly and stay asleep and get the rest.
Right.
But in reality, right? I mean, if you've just been on your phone and you don't have blue blocking glasses, or if you
Mhm.
don't have, the app on your phone to make it red,
Right.
then and you have all these lights around you, then you're getting that blue light straight into your eyes,
Yeah.
which is impacting your melatonin,
Yeah.
right?
100%. Yeah. It's suppressing it for sure.
Which
Yeah.
is
And
which is not helping you sleep, right? Because
at
I mean,
all.
melatonin. I mean, can you talk to that?
Yeah. So melatonin generally is made it starts to come out about an hour or two before you would naturally go to bed. And whereas cortisol is our sun, melatonin is our moon. And so melatonin comes out for sleep. So it's really important for onset of sleep. And if you have a lot of stimulation and you have a lot of blue light in the eyes, specifically you have, they're called melanopsin in your eyes that register this blue light, your cortisol is up, and cortisol is tougher and stronger than melatonin, so it will suppress melatonin. And now maybe you don't get a melatonin rise until later in the night, and you wake up groggy because melatonin can make you feel kind of groggy. So you get this sort of delayed onset production of melatonin, which leads to a delayed onset of when you would feel awake, but your alarm goes off at 6, but you still have the melatonin hangover. So now you kind of wake up groggy, and by about 8, a couple cups of coffee, you're like, okay, now I feel human again. This is good. Whereas if you had started the night before with better hygiene habits, then you maybe over time wake up at 6, at least more functional. You're better and ready to go when it comes to melatonin. And
Yeah.
so we got to be
It seems so
careful.
simple almost, doesn't it? In the sense
People
that,
hate it because they
yeah,
just want a pill. They're like, I don't want to do that. I don't want to get off my phone. I don't want to wind down at night. I don't want to get off Netflix. Like I'm watching all these scary shows. I don't want to stop doing that. I don't want to get up in the morning and have to waste 10 minutes enjoying the fact that it's light out. It almost seems too easy and too I don't know, woo woo or stupid. And I'm like, it's literal science. It's literally how your clock genes work. Like they function off of light and dark. They won a Nobel Prize 2 years ago. Like, just give them what they want. Light and dark. Stop
yeah,
fighting it.
right. And also, I mean, for those people who are saying, "Oh, well, I'm taking sleepy pills, or I take exogenous melatonin," and I'm fine. I mean, shouldn't we actually be
Maybe.
able to sleep?
Yeah.
Yeah, it's
Yeah, that's what's hard.
we as humans, we as animals, women, which we are ultimately, we
Mhm.
should be able to sleep and have a good night's rest and not have to take something externally because our body is not producing it on
Right.
time.
Right. Yeah. A lot of those sleep pharmaceutical medications, yes, they will knock you out, but they do mess up. You don't necessarily get through all of your stages of sleep. And so therefore you may not wake up rest and restored and healed like you should being off the medication. So that can be really challenging for people. And it can
Mm.
be challenging for things like their own melatonin production and their own cortisol production. And then they want to get tested, but they're on this sleep pill, like Ambien as an example, or Sonata. And they're like, oh, should I stop the pill before I do this extra testing? I'm like, well, if you do, probably won't sleep because you're now addicted to it. That's what you rely on to sleep. And whether you need it or not at this point, if you pop that pill, you sleep. And so if I take the crutch away, mentally, it's going to mess you up. Mentally, you're going to go, oh, I'm not taking the pill. I'm not going to sleep. So it becomes really challenging.
Yeah. So for those types of people who are on sleeping medications, do you, as in your practice, would you just start to wean them off and put them on something like a natural form of, again,
Yeah,
melatonin,
yeah,
valerian, and then wean them off of that?
yeah. It depends on the person. Yeah, and the good thing is a lot of them, like Ambien and Sonata and what have you. You can do a lot of things at the same time, and so I can ramp one up while I'm working to decrease the medication and figure out the cause.
Mm.
Yeah. Unlike other medications, for example, like an SSRI, so an antidepressant medication, it's be very careful. Like you have to be very careful on, people go, oh, I'll just take 5-HTP because that will raise serotonin too. I'm like, no, actually you have to be very careful. You could really harm yourself being on 5-HTP and on an SSRI. You just have to be mindful of that. So, but the sleep medications are a little different. And so I generally find that the herbs and the nutrients that are more calming that I can start to ramp them up as I'm ramping down.
Again, like you said, light is one of your biggest hacks.
Mm-hmm.
What other type of kind of the big ones that you see really impact people? The
Yeah.
quickest the most?
How you breathe is a big one, right? So mouth breathers, disordered breathing, snorers, even light snorers, people have sleep apnea, hugely impactful negatively on your health. If you're not getting oxygen in properly to your brain, you're not going to be healthy. It's oxygen. It's oxygen to the brain. Like, what does the brain need? The brain needs oxygen. And so if you are sleeping with somebody and they snore all the time, know that that's completely affecting their brain health and all the hormones downstream. And there's so much research on this. It's crazy. If you yourself are a snorer or you're a routine mouth breather, when you walk, you breathe through your mouth. When you're sitting there on your computer, you're breathing through your mouth. You need the air to go through your nostrils. You need the warming effect. It helps nitric oxide. It gets your oxygen appropriately versus breathing in this way, which is different. It's a huge night and day difference. And so we see a lot on the hackers who'll do mouth taping, right? So mouth taping with there's companies out there that provide mouth tape, or you can do like surgical tape, but it's exactly what it sounds like. It's literally taking appropriate tape and taping your lips, sort of gently closed at night so you don't actually open your mouth and start breathing out of your mouth, and it forces you to breathe out of your nose. And what's interesting is even the people who day mouth breathe have started when they're working on their computer, like they will tape their mouth shut, and it's to remind them, use your nose, use your nose, use your nose, because they will just sit there and, sound kind of like an ogre as they're breathing out of their mouth and not realize it.
Yeah.
And that makes a huge impact. If you have sleep apnea, you have to get that evaluated. If you're a snoring person, you have to get that evaluated. No joke.
I haven't thought about this. And now as we're talking, I'm trying to figure out how I'm breathing.
Do I breathe out of my mouth? I know. And it's funny as I become really conscious of it. Like my husband, if he starts mouth breathing, I'm like, he knows this. He's practiced with the mouth tape before and he's aware of mouth breathing, but now I pointed out to him, I'm like, you're mouth breathing again. He's like, no, I'm not. Like, you are. But I first learned about mouth breathing from Mike Mutzel years ago. And since then I've read so much research just about how the lack of oxygen from our inappropriate breathing to our brain affects everything downstream. And I'm focused mainly on hormones and hormonal outcome. That's a big hack. The other one is mitochondrial health. I don't think people realize hormones are made in the mitochondria of our cells. And so that we learn in school that mitochondria are our cellular powerhouses, and they really are. They make our energy, but it's also the first step of where hormones are made. And so if we are exposed to a lot of toxins and if we're missing nutrients that are important to our mitochondria, if we're doing things that, affect mitochondria, that will also downstream affect our hormones. We won't be able to make them as well. So mitochondrial support and health and, nourishment is really, really critical for hormone production.
Yeah. And I think I wasn't aware actually that hormones were created in the mitochondria. That's new to me.
So you have a protein called star protein and it binds to cholesterol. That's the very first step. It comes to the mitochondria. And then the next thing it makes is pregnenolone. And then pregnenolone goes out to the endoplasmic reticulum to get totally nerdy. And then some of those hormones circle back around like cortisol and finish off in the mitochondria. But you always start in the mitochondria. So if your mitochondria are few and far between, or if they're sick and unhealthy, then you're going to struggle to get that first step right. And you could be struggling to have the rest of your hormones right. And, we know with mitochondria, like fatigue is a really big symptom for poor mitochondrial health, especially like muscular fatigue, muscular weakness and stuff like that. Because that's where a lot of our mitochondria are.
I think a lot of the research that I've seen in terms of mitochondria goes back to what we were just talking about before of light, water, magnetism. Kind of those three elements being so vital, so important to your mitochondria. So making sure that you're getting good light, making sure that, all these devices, which are kind of sucking electrons from us, right? Mm-hmm. All the non-native EMFs, going out and having grounding, which is walking barefoot, which again sounds very woo-woo and sounds really just hippy dippy, but
but trust us.
Behind it. Yeah, there's a lot of science. And then probably also the element of cold and cold water and saying, okay, well, that also is free and kind of difficult to do, I guess, in the beginning when you start taking cold showers, but that also can have an impact to your mitochondria. And then it seems that now a downstream impact to your hormones.
Absolutely. Lifting weights, right? Building muscle, weightlifting, not cardio, but weightlifting, good for the mitochondria. Yeah.
Well, I know that we can have hours and hours and hours of this conversation. This is fascinating. So hopefully this is just part one of a dialogue with you, but this is tremendous. So what's one health hack that you've done in the past that maybe didn't work as well as you thought?
Keto.
Keto. Okay.
Keto, cutting carbs completely. I should back up. And I don't mean this, I'm not like knocking the keto community, but I have gone, nope, both times I tested to make sure I was in ketosis, and I was. I did check my ketones. I tried keto twice, and both times keto makes me the meanest, most bitchiest person ever. The first time I was just doing it wrong. So the second time when I did it, I was like, okay, I'm gonna do it much better. I've done more research. I'm further along. No, no, I am not a pleasant person to be around when I am on keto. So I do not do that. I am not a grain-free person and all that.
I've had a similar situation. So again, it's an N of one. You know, for some people, they
Yeah.
swear by it,
Yep.
and it's tremendous for them. And there's been a lot of amazing research, but
Yep.
for others, maybe not so much.
Not so much. Yeah. Boy, I get a lot of push. Like, you should be, I can't believe you eat, carbohydrates. I'm like, trust me, I have done it twice, and you do not want to be around me.
Yeah. You want me to eat the carbs.
Yeah, exactly. This is for your benefit, not mine.
Yep. Yep. What would you tell your 15-year-old self?
Honestly, I would tell her just to go ahead and stop gluten now.
Okay.
So I have celiac, and so I figured it out. I think I was in my late 20s, early 30s when I figured it out. And man, if I could have figured it out at 15, I think that would have made a world of difference just to know then, to give me a big jump. But the other thing I would tell my 15-year-old self is you're on the exact right track. Just follow your intuition, and it's going to be great. Yeah. Just give up gluten.
I really like the part about intuition as well, because I think oftentimes I feel like I've only started listening to it now. And this is in my third decade. So, it's, listening to that it takes time. That's I feel like it's a lesson that you only get to later on.
I agree. Just time and experience, right? Then you
Yeah.
learn to trust yourself, and then turns out you're usually right all the time.
If you could wave a magic wand and change one thing about women's health, research, anything of the above with respect to women, what would it be?
That's so funny. When I lecture, I always tell women all the time that I would like to be the goddess of women's health as it relates to like this stuff, hormones. I don't want to be the goddess of like everything around women's, just around like hormones would be great. So I'd say the two big things that I would wave a wand over that I get the biggest questions on. One is around fertility. I would love to have the ability that we'd like press a button, flip a switch, and yes, we can get pregnant, or no, we would choose not to get pregnant at this time. I think that would save a lot of heartache. It would answer a lot of questions, and it would not require us then, of course, to go use the pill, the patch, the ring, the IUD, what have you, and then be at risk for the fallout of that as well. So that's one thing I would change, is if we could just have a button, that'd be great. The second thing I would change is that I wish perimenopause would be so much smoother and well respected for women. That as women get older and age gracefully, that it's actually revered, as opposed to, a lot of people are horrified and so they don't want to get older, and they fear getting older, and they have a lot of these feelings of they're not what they used to be when they were younger, and they don't recognize that it's their next great phase in life, and mostly because the symptoms suck. If the symptoms were amazing, like if our hair got like lush and luxurious, if we lost 10 pounds instead of put on 10 pounds, if our energy, like if everything just got better, then we would look forward to menopause, as opposed to now with the hot flashes, the night sweats, and the vaginal dryness, and the no sex drive, and the brain fog, and the skin thinning and wrinkling. Like, it's like, ew, who wants to do that? And so that's what I wave my wand, is to be like, let's revere this transition, and let's really educate how to make it as healthy and happy as possible moving forward. So I know you said one thing, but I had to pick two.
It's all good.
Fertility and menopause.
I like it. That element of revering the changes is a big one, and there is, in older cultures, it's always been that as someone gets older, they become the sage, they become the wise one. And because of the different experiences they've had through life, and perhaps going back to that, hearkening back to those cultures, which kind of had it right. Whereas now it's just, this is something that you need to deal with on your own. Last question is, what has been one teacher or book that has changed your way of thinking?
It's called Estrogen Matters by Doctors Blooming and Tavris. I don't know if you can see that. Estrogen Matters. You said earlier, that estrogen gets a really bad rap, and it does. It's definitely like Goldilocks. Too little or too much can be a problem. But Estrogen Matters is a book written about estrogen as women do get older and maybe head into perimenopause, and estrogen hormone replacement therapy, HRT. And it just really goes into a lot of the science and the research and the literature around estrogen and how important it is for women. And I was always generally very pro estrogen, even though I was a minority. A lot of are like, oh, it causes breast cancer. Like, you're crazy. And then this book really just sort of summarized a lot of the literature to be like, actually, estrogen is pretty important for the female body, and here's why. And actually, it does get a pretty bad rap around breast cancer, and here's why. And it's not all that meets the eye. And subsequently, as a result, there's a lot of really cool research happening right now around estrogen and women, and even in the Dr. Mascani's Alzheimer's research, and she's starting to look at estrogen and talks about estrogen and its role in the brain, just in general. And so that's just really helped me as a woman myself, right, who's getting older, not to fear estrogen, just because I have estrogen doesn't mean I'm going to get breast cancer. It's actually really helpful. And I probably want estrogen for as much as I can to age gracefully, but not even just the look, but like how my heart ages, how my bones age, how my joints age, my brain ages. That's really important to me because longevity runs in my family. So I'd like it to be, pretty smooth, pretty tip top. So yes, Estrogen Matters was a great book for me, just to like summarize and pull all that together and quote a lot of research, which was wonderful.
Fantastic. Well, Carrie, thanks again. This
Thank
is
you.
incredible. I mean, you do such a beautiful job just blending together the science, the intuition, the old school thinking, or the woo-woo of light, of water, of
Yeah.
these things that are natural. I just really like how you're able to combine all of them together and really have a base of science to back it up.
Yeah.
So thank you for everything that you're doing. We can find you at Dr. Carrie Jones, right, on Instagram, as well as the Dutch test. I'll
Yep.
make sure that we link in the show notes, and hopefully we'll get you back again on the next episode.
Absolutely. Yeah, I appreciate it.
This has been tremendous. Thank you.